Proper function of all body systems require a balance of electrolytes. The body works best when these electrolytes are kept within a narrow range of normal. Electrolytes, or aka ions, are substances in body fluids that carry an electrical charge. So let's talk about the basics of electrolytes. These electrically charged ions are cations and anions. Cations have a positive charge. Anions have negative charges. Body fluids are electrochemically neutral, which means that the number of positive ions is balanced by an equal number of negative ions. However, the distribution of ions differs in the extracellular fluid and intracellular fluid. These electrolytes differ in concentrations between compartments, which helps maintain membrane excitability and allows nerve impulse transmission. Very narrow normal range and small changes in these levels can cause major problems. Electrolyte homeostasis is controlled by balancing the dietary intake of electrolytes with the kidney excretion or reabsorption of electrolytes. The major electrolytes are sodium, potassium, calcium, chloride, magnesium, and phosphorus. A table is provided on page 170 of the electrolytes with reference ranges and significance of abnormal values. We will discuss each electrolyte individually through this lesson. Click on an electrolyte to learn more about that electrolyte. Once you have reviewed all the electrolytes, click the arrow below to advance into the lesson. Let's talk about sodium. Sodium is a mineral. So, is it a cation or an anion? It is the major cation responsible for extracellular fluid osmolarity. Sodium levels of the extracellular fluid are high and the intracellular fluid sodium levels are low. Keeping this difference in sodium levels is vital for skeletal muscle contraction, cardiac contraction, nerve impulse transmission, and normal osmolarity and volume of the extracellular fluid. To maintain electrical balance, the sodium cation level within a body fluid must be matched by an equal number of anions. This balance is referred to as electroneutrality. Normal extracellular fluid sodium level is 136 to 145 milliequivalents per liter. Sodium is provided through ingestion of many foods and fluids. Snack foods and condiments are often very high in sodium. Despite variation in sodium intake from one day to the next, the blood sodium level usually remains within the normal range. Serum sodium balance is regulated by the kidney under the influences of aldosterone, antidiuretic hormone, and natriuretic peptide as described previously in Back to Fluid Basics lesson. Click the arrow below to continue through this lesson. Okay, now we're going to discuss potassium. Is it a cation or an anion? Potassium is the major cation of the intracellular fluid. There is a narrow therapeutic range for potassium, and the normal level is 3.5 to 5.0 milliequivalents per liter. Potassium is contained in almost all foods, highest being in meat, fish, and many but not all vegetables and fruits. Potassium's high levels inside cells provides it to have some control over intracellular osmolarity and volume. Maintenance of the large difference in intracellular potassium levels and extracellular potassium levels is vital for excitable tissues to generate action potentials. Other functions of potassium include regulating protein synthesis, and regulating glucose use and storage. The main controller of extracellular fluid potassium level is the sodium-potassium pump within the membranes of all body cells. The sodium-potassium pump removes 3 sodium ions from the cell for every potassium ion that it returns to the cell. Potassium control also occurs through kidney function because about 80% of potassium removed from the body occurs by the kidney. Kidney excretion of potassium is enhanced by aldosterone. Unlike with sodium, the kidneys do not directly conserve potassium. Click the arrow below to continue through this lesson. Calcium. It is a mineral with functions that closely relate to those of phosphorus and magnesium. So is it a cation or an anion? Calcium actually is an ion having 2 positive charges, aka divalent cation, that exist in the body in a bound form and an ionized, which is unbound or free form. Bound calcium is attached to serum proteins, especially albumin. Free calcium must be kept within a narrow range in the extracellular fluid related to it being the active form, and this range is between 9.0 and 10.5 milligrams per deciliter. Calcium enters the body by dietary intake and absorption through the intestinal tract. Dairy products are common foods that are high in calcium. Absorption of dietary calcium requires the active form of vitamin D. The main functions of calcium are to maintain bone strength and density, activation of enzymes or reactions, allowing skeletal and cardiac muscle contraction, controlling nerve impulse transmission, and to allow blood clotting. When more calcium is needed, parathyroid hormone is released from the parathyroid gland. When excess calcium is present, thyrocalcitonin is secreted by the thyroid gland. Click the arrow below to continue through this lesson. Okay, so chloride is the major anion of the extracellular fluid, and it works with sodium to maintain extracellular fluid osmotic pressure. Chloride is important in the formation of hydrochloric acid in the stomach, and the normal plasma concentration of chloride ranges from 98 to 106 milliequivalents per liter. There is only a small amount of chloride present inside the cells because negative charges on the cell membrane repel chloride and prevent it from crossing the membrane. Click the arrow below to continue through this lesson. Okay, magnesium is a mineral that forms a cation when it is dissolved in water. Adults have an average total body level of 25 grams of magnesium, most of which is stored in bones and cartilage. A small amount is present in the extracellular fluid. Plasma levels of free magnesium range from 1.3 to 2.1 milliequivalents per liter. There is a larger amount in the intracellular fluid, and it has more functions inside the cells than in the blood. Magnesium is present in low levels in most foods. Magnesium is critical for skeletal muscle contraction, carbohydrate metabolism, adenosine triphosphate formation, vitamin activation, cell growth through DNA synthesis, and protein synthesis. Magnesium regulation occurs through the kidney and the intestinal tract, although the exact mechanisms are not known. When blood magnesium levels are low, ingested magnesium is rapidly absorbed and kidney excretion of magnesium stops. When levels are high, little magnesium is absorbed from food and kidney magnesium excretion increases. Click the arrow below to continue through this lesson. Phosphorus is in the body in both inorganic and organic forms. Normal serum levels of phosphorus range from 3.0 to 4.5 milligrams per deciliter. Most phosphorus can be found in the bones. It is the major anion in the intracellular fluid, and its levels inside cells are much higher than in the extracellular fluid. Food sources high in phosphorus include meats, fish, and dairy products or nuts. Phosphorus is needed for activating vitamins and enzymes, forming and activating adenosine triphosphate aka ATP for energy supplies, assists in cell growth and metabolism, and functions in acid-base balance and calcium homeostasis. The regulation of extracellular fluid, phosphorus, occurs through the activity of parathyroid hormone. Increased parathyroid hormone levels cause a net loss of phosphorus. Reduced parathyroid hormone levels enhance kidney reabsorption of phosphorus, resulting in increased plasma levels of phosphorus. Click the arrow below to continue through this lesson. The changes associated with aging affect the skin, renal, muscular, neurologic, and endocrine, as previously discussed in Back to Fluid Basics lesson. You may review Chart 13-2 again on page 170 to refresh your memory in regards to changes associated with aging that can affect electrolyte balance. The general assessment should include a history. You can use Gordon's functional health patterns, asking questions such in the areas of nutritional and metabolic patterns or elimination patterns. You'll check into weight changes, excessive thirst or drinking, types of environmental temperatures, kidney or endocrine diseases, and then check their level of consciousness and their mental status. The actual physical assessment will include hydration status, their skin turgor, intake and output, insensible water loss, loss from other routes, neuromuscular assessment, a cardiac assessment, and then of course the gastrointestinal assessment. The psychosocial assessment should include questions in regards to depression, bulimia, anorexia, and social practices. Diagnostic studies will cover like a CMP or a BMP to check normal electrolyte levels. You can check the BUN, blood glucose level, creatinine level, the pH, bicarbonate level, osmolarity, and then of course hemoglobin and hematocrit. This concludes this lesson. If you have any questions related to this course content, contact the instructor.